Hey everybody, Matt with Freestand here. Got a special guest on the show today, a doctor, our first doctor. But it's Meaghan Rice, and she is a psychologist. She's out in Arizona, Tucson, Arizona. And I wanted to have her on the show today to talk a little bit about virtual therapy and running an online practice and everything within that. So thank you for coming on. How are you?
My pleasure. Thanks for having me.
Of course. So anyway, let's just dive right into it then. So how did you get started? Kind of what was your path to becoming a therapist in the first place, or a psychologist, sorry, and all that first.
Totally. Yeah, it came pretty easy to me. I think I knew from an early age that I always wanted to help people. I think originally I thought it was going to be in the form of being a teacher, and helping people out with education and academia. And originally, I think that the teacher desire kind of morphed into like wanting to explore people's narratives a little bit deeper. So yes, definitely wanting to help people, definitely wanted to guide and coach and mentor, but it kind of morphed into like, I think there's a bigger thing going on. I think I could be really useful in this spot that says like, okay, we all have super positive characteristics. Great. I think we should, focus on those strengths. But there's also a dark side to each and every one of us that I think is often overlooked. But it's the dark spot, I think, that we need to be able to access, because I think there's a lot of freedom in acknowledging what's wrong with us. I think there's a lot of freedom in acknowledging our flaws and kind of bringing that to the forefront. So I jumped right in and I started working with criminals in private correctional facilities. And I quickly moved around in that setting. I loved it. I was thriving in that environment where, people that are incarcerated, I think, have a tendency to kind of see life through a very specific lens. And sometimes I think that lens can take them away from empathy and kindness and ethics and morals and a lot of the things that I think we need to get outside of the scope of the antisocial personality disorder characteristics. A lot of the things that, we can train and hone in on and make better, especially if we're acknowledging those things as a weakness. And so it kind of took off from there. Then I went into community mental health and I saw the same thing. I saw this world of people really wanting to share their stories. I'm super easy to talk to. So I found that like as I went along in the community mental health settings and psychiatric institutions and eventually morphed into a private practice situation, I was still seeing the same thing. People wanting to share, people wanting to express their narratives and wanting to share the whole story, not just the story that says, life is butterflies and rainbows, but like, let me share my traumas and let me share like my negative experiences with you. And let me share, kind of these aversive things that have happened to me. And I'm going to lay all of these things out on the table, good, bad, and the ugly. And I'm hoping that you can just help me sort through them, an impartial view and, a not biased sort of view. Give me a different lens, give me a different perspective. And so over that period of time, I found a military man and he stole my heart. And so he took me away from this stable, I go to the same job every day and I live in the same location, to like all of a sudden uprooting me and taking me across the world. Like literally, I've been across the world. And so I had to, you what?
I was just going to ask, where have you gone, like, with your husband?
We just got back from France, actually.
Oh,
So when
that's
I say
awesome.
like around the world, we like literally have gone around the world. And we became essentially these rolling stones that gather no moss. So I was like, how can I help people still, with their narratives and their stories and making sure we're honing in on like the negative stuff in order to achieve more positive things. And I was like, you know what? I'm just going to take it with me. I'm going to get licensed in a couple different states. So I have like kind of this flexibility in seeing different clients in places that we've lived in the States. And then I'm going to take it with me to France. And continue everything as normal, doing exactly the same thing that I've always done. COVID hit while we were in France. And so I was not only like kicking into gear with my online telehealth work. But we were also locked down. France is very strict. We were locked down for 11 weeks straight, and we were only allowed to go to the grocery store and back.
Wow.
And my caseload doubled, tripled,
I'm sure.
quadrupled at that point. And it was just about getting a little bit more creative, I think, getting more creative in how I'm supposed to access people when they're not allowed out and about. Honestly, they're not allowed to go anywhere. They're not allowed to like leave their safe setting. So how can I stay in my safe setting and they stay in their safe setting, and we merge and create a particular focus that we could work on. And it was in that spot that I decided that I'm not such a traditional counselor. I'm more of a outside the box type of counselor, and that I'm interested in the people around you. I'm interested in your relationships, your intimate relationships. I'm interested in your friendships. I'm interested in like your role in the community. Even in individual sessions, I'm taking people at their word to a large extent, but I'm also like very interested in pulling these other people into our work together to see like what their lens of the particular individual is, you know, like if there's any sort of helpful feedback or any sort of perspective that I haven't already thought of that they can contribute. So that shifted into like my work with couples and families and groups and teams. And that's kind of where I am today.
So right now, well, first of all, that was a great explanation of everything.
Sorry, long-winded.
Good job. So when you went to France, how long were you in France before the pandemic hit?
We were in France for about 5 months before the pandemic hit. So I had like some time to settle in, and then it was full blown. Wow. I had already started working for Talkspace in 2017. And so I was able to continue seeing international clients and then see all the clients that were part of the states that I was licensed in. So when I say like my caseload took flight with Talkspace, it honestly did. And then subsequently, it took flight with this new non-traditional therapeutic approach. So a good year in France, kind of managing the COVID experience, having 5 months of not really doing much COVID specific stuff, but then a good solid year of being in the midst of that.
So you had some time to acclimate to the French culture, and then once you got acclimated, boom, the pandemic hit. Yeah, that's crazy. So I'd love to dive into that more, but back to the running your practice. So when you were in the States prior to going to France, were you running a virtual practice? Were you meeting with clients on Zoom and other platforms, or was it all in person? Like
I was doing a combo. Yeah, a combo before I left for France, and then France, full-blown telehealth. And then since I've returned from France, I've only been doing online counseling. So,
So you were doing the combo. You said you've been on Talkspace since 2017, right?
Totally.
And that's in Talkspace is what got you started doing the online piece of it?
Yeah, I was actually like Googling one day. I Google often, helping my clients, helping myself, living our best life on Google. And I was just Googling like, hey, is anyone doing like telehealth, like primarily telehealth, where there's like a combo of messaging and video recordings and audio recordings and live video sessions on a screen. And Talkspace came up as my first option. I was like, I'm just going to reach out to them and see, what they've got going on. And I was hired right away. I had a trainer that kind of showed me through the process, and I really liked it. I really liked it from the start. I just felt like it was just this amazing opportunity for everyone to essentially access mental health. Whereas before, I think a lot of people were limited by certain resources, a vehicle to get to a clinic, maybe not wanting to face any sort of mental health stigma if they went to a clinic and someone else saw them in the community. Yeah. A lot of my communities are small, right? So clients know of each other. They know of the therapist, everyone knows who's
Sure.
getting counseling and who's not, right? So it kind of like took away the stigma. It took away like the preventative resources, extra money to, you know, use gas, fuel to get to the appointments, you know, have a vehicle to get there. There were a lot of other like challenges, especially my specialty is couples counseling. And so I see a lot of couples on Talkspace as well as part of my private practice. And it's so hard if couples are like traveling or they have different schedules or they have a whole bunch of different things going on. Like it is so impossible these days to get two couples in the same room in a clinic to be able to see them face to face. So, you know, Zoom is great. You know, Talkspace has a platform similar to Zoom. I've got Theranest, which is another online platform that enables me to do video sessions with clients. Both members of the couple can pop up on the screen. You know, all the members of the team can pop up on the screen and work with you. Families can pop up there. So it just kind of, I don't know, expanded my world, broadened my horizons in a sense.
I think like in terms of the internet and making things like evenly distributed for different fields, I think probably therapy and being able to get in touch with the psychologist is like the most important one, or one of the most important ones, because you're 100% right. I mean, the amount of people I'm sure that prior to something like Talkspace coming along, or any of the other sites that are out there, you know, I'm sure would have gone, but they didn't want to tell, you know, members of their family that they were going or whatever. And now they can just do it on their phone or on their computer, like sitting in their bed, which is just remarkable.
The military community too was another spot that I didn't mention where, you know, there's a little bit of bias associated with someone in the military that also receives counseling, independent from what levels of severity. I think there's hey, go to counseling a couple times, but if it becomes more than a couple times, you know, maybe you're placed in a category that says, we're not quite sure where this military member stands, right? It could be very innocent and, you know, just needing some marital help or, you know, a couple quick fix solutions. But you go outside of the 3-session mark and there's a little bit of bias there. So this gives military members the opportunity to receive counseling kind of undercover and for the length and time, duration, intensity that they need in order to feel successful, in order to reach their goals.
Yeah.
The stigma stuff I think is so big.
That's really interesting with the military, though, because I know a few of my friends, one who's in the Coast Guard and one who's was in the Marines. But I remember they were telling me when they were like filling out their applications, one of them took a prescription medication for ADHD, and like even putting that down was gonna like you know, was gonna mess up whatever he was doing or what position he could have had. So it's like, it's just crazy. And
I think people get the wrong idea. I think mental health is one of those topics where we're not like super well versed in it because it's not as transparent and authentic as I think it should be. And so I think when people see mental health, they immediately say like, oh, there's something majorly wrong with that person. But frankly, I think we all need a counselor.
I agree.
You know, I benefit from a counselor in the same way that I think other people benefit from me. I think it's a pay it forward system where we're just trying to increase transparency and authenticity rather than saying like, oh, you know, you're bad or you're different or you're weird, you know, or you're less than of a human being because you need access to a counselor. The people I'm most concerned about, honestly, are the ones that think that they don't need any form of counseling and they don't need to hear a different perspective or have a different lens. I think those are the concerning ones. So when people come to see me, that's the first thing I say is like, I'm so glad you're here. You know, it's such a huge step. And I think like this is the first step in, you know, getting your behaviors in alignment with your values. And I'm just so excited to be a part of that experience for you.
Yeah, absolutely. I think especially in American culture, it's just kind of looked at as a sign of weakness, especially with men. But it's not. It's really a sign of strength. Like if you can recognize the fact that it would be good for you to do something and it's going to improve your life, you're only going to strengthen your life. So, it's a good thing. In terms of working with your online clients and everything, do you feel like there's anything missing that you were able to do in person, like having that one-on-one face-to-face conversation as opposed to doing something virtually like this? Do you feel like there's anything missing? And if so, what would that be?
Anything missing? It's hard because I can like never imagine myself in like an in-person setting ever again.
Yeah.
I feel like I've been spoiled in so many ways. So I'm probably a little bit biased at this point. I'm not going to lie, towards the telehealth realm. But one thing I was talking about with my coworker the other day was this idea of like, so pants aren't required, right? For the telehealth experience, they're not required. Waist down, nothing,
Sure.
nothing is required there. And so while that seems like a no-brainer, we only need top up anyway, because that's where all the goodness happens, the emotional expressions and the tone change and the livelihood, the animation, like all this stuff happens on top. I've noticed that I kind of miss like the bottom stuff, like does the person cross their legs? Do they sit with their legs wide open, or are they totally casual in their own skin, like kind of lean back, not so tight in their form, or they, really rigid and kind of inflexible. I think there's some things on the bottom, not to
Sure.
sound,
Well, you're doing you're doing a full body analysis.
Yeah, so like I need the full body experience sometimes.
Is it better if we back up?
Yeah, we're still missing like some key components. We get to see
Sure.
like 50% of the person, and I didn't ever think that I'd miss the bottom half, the other 50% of the person. But when you don't have it for a certain period of time, you're always curious. Like what are you doing with your hands?
I wonder what's going on down there. Yeah.
Yeah, sometimes I'll ask my client, like, what are you doing? Are you like flipping something? Are you like flipping stuff off your desk? Are you like holding on to something? I'm just curious
your
about
nails.
like, whatever you can't see. Curiosity kills the cat sometimes, but I'm just kind of nosy in that regard.
Got it. In terms of Talkspace and the other platforms, what was the other platform that you mentioned? It was Talkspace, and then there was one other I think you mentioned.
I'm also a counselor for BetterHelp. So I'm a counselor for Talkspace, BetterHelp, and then my private practice stuff incorporates being insured with some insurance panels.
Okay. We'll get into that piece after. But the BetterHelp, Talkspace and BetterHelp, those are like the two main platforms that are out there, right? Like the two big ones? Okay.
Yeah.
And how does it work in terms of working on one of those platforms? Do you need to be a psychologist, or can you be a licensed therapist?
You have to be licensed. So either one of the platforms are going to require licensed therapists.
Okay.
So licensed psychologist, whatever licensure you have in the mental health field, all of it is acceptable, I think, at this point. So yeah, just being licensed rather than like supervised or, in graduate school doing practicum or internship, that type of thing.
Got it. And then you make a profile, and then you kind of like describe what type of therapy you do and kind of a little bit about yourself. And then is that how it works? And then you post that on Talkspace and then people find you?
Totally. Yeah. So same thing as like Psychology Today, where you have a picture, obviously a professional picture, an appropriate picture, biography as to like what your treatment modalities are, what you tend to specialize in, focus on, and then just kind of an outline of what you expect your schedule to look like in your work with the particular clients that you receive on Talkspace or BetterHelp. So just a very vague outline. And then we use the chat specific feature in the room to talk about scheduling and talking about what their plan offers and talk about their needs. And then we can hop on a live video session if that's part of their plan or that's part of their needs. Any other time we focus on like texting and audio recordings and video recordings.
Got it. Very cool. And how does it work like from a money standpoint with Talkspace and BetterHelp? Do they take like a regular transaction fee, or is there some other type of incentive for them?
Yeah, they take the money on the front end, and then we get paid for the work that we do.
Got it. Okay. So the customer pays up front, or not the customer, the patient pays up front, and then they process the transaction. Okay. And then.
Exactly. Or if it's an insurance company, if an insurance company is contracted with Talkspace or BetterHelp, the insurance company has dictated the rate in which the reimbursement happens. And so that would require you to like submit a particular note in order for the insurance company to reimburse Talkspace, and then Talkspace reimburses you as the therapist.
Got it. Okay. And then that's the other thing I wanted to get into was, so you use BetterHelp, you use Talkspace, and then also you have your own private practice, which is separate from these two websites. And you use Psychology Today mostly to drive people to your private practice. Is that right? And then and then you're hooked into the working with different insurance companies that direct clients to you, right? So if you could talk
Totally.
if you could talk a little bit about that, that'd be awesome.
Yeah. So part of my private practice is that I'm on Psychology Today. So I get a lot of referrals that way. I also post what insurance companies I'm licensed with. So the insurance companies that I'm an in-network provider for. I'm currently with Stigma in Colorado, and that gets me quite a few referrals, honestly, especially because I specialize in couples counseling.
Mm-hmm.
And then I'm planning on adding Anthem to that. So I'll add Anthem to my Psychology Today profile. So that'll include Cigna and Anthem in Colorado. And then in addition, I do couples workshops on the side. And so I do couples workshops for lasting. And as part of those couples workshops, people will hear from me, for the hour and a half that I do the workshop and do a Q&A. And then they're interested in seeing me individually, like their issues go a little bit further than the workshop. And so they want to dive in to more specific issues with me alone.
And
so they'll read. Yeah.
Sorry, I was just going to ask, where is the workshop? So is this like a virtual workshop that you host?
Yeah, Lasting is an app. It's a pretty cool app. It's a branch off of Talkspace, but they have all these different resources that couples can use, worksheets and curriculum and programming of sorts on their app. And then they host live workshops. So you can take some of that curriculum. I actually develop content for them too. So I develop my own content, and then I give a workshop, like a training webinar style, where partners are actually partnered up on the Zoom forum. And so it's just audio. So they just listen to me and see me, but I can't hear from them other than like a typing Q&A chat. And so I answer those questions after the end of the workshop. But the workshop is amazing because it's like the full comprehensive experience using some of the resources that they developed on the front end. So all virtual, just jump in, hear me, see me, learn some new skills in regards to how you approach a relationship, especially if it's struggling, and then Q&A after, and follow up with me for an individual session if you feel like your issues go a little bit further.
Wow, that's awesome. And that's an extension of Talkspace.
It's an extension of Talkspace. Yeah. So they have different deals for each other. If you want to be a lasting couple and then go to Talkspace for couples counseling, you can do that. If you want to be a Talkspace couples counseling participant and you want to go to lasting for more resources, you can do that with discounts on both ends. So it's very interchangeable. It's a nice synchronous flow.
Yeah, that's very cool. And so with lasting though, if you're doing kind of like this webinar format, or not webinar, but it's kind of like you're doing this audio therapy session where you're not interacting directly with somebody, are there tons of people that are listening, or is it just like one person signs up to listen to you?
It's been over 100.
Okay, so it's a lot of people listening.
It's a lot of people. Yeah, you can just see the kind of Zoom numbers, skyrocket as soon as the webinar starts. My webinars are a little bit later because I'm geared up for West Coast folks. So you see like a few couples, drift off or want to watch the webinar later. They do all recordings of our webinars, so you can access that on the app too. If you missed the workshop for whatever reason and you want to watch it later, it wasn't the right time, or you're just really super interested in the topic, you can access it later. So it's nice that it's kind of like this storehouse for all of these valuable resources.
Yeah, and you have this like on-demand library of all of these different things. That's really cool. And do they sign up? Does the patient sign up like and pay like a subscription, or do they pay like per webinar and then you host it?
Combination. There's like a regular monthly subscription fee, and then I think there's a little bit extra of a fee for the workshops or the retreats. I know they do retreats too. I'm gonna help them with a retreat coming up on the 24th of April. So I think it's just a little bit of extra money for the live workshops or the retreats if you want to like actively participate in them while they're going on.
Is it a virtual retreat?
Virtual retreat.
See, like all these things, I'm like, retreat, virtual? That's crazy.
So sweet. That's why I say, like, I don't know that I could ever go back to the in-person setting because it's just so easy, you know, like if I want to wear my PJs on the bottom, I can do that.
Yeah.
And the clients can too.
That is crazy. So what does the retreat entail? Like when I think of retreat, I think of like a bunch of people going up into the mountains and hanging out in like a bunch of tents, or I don't know, something, you know?
Yeah, I think just like that. Honestly, I haven't done one before, so I don't know exactly how it goes, but I would imagine like a series of different workshops all within the same like clump of time. So I think it was like a 4-hour retreat on a Saturday. And so I'm sure I'll be responsible for hosting like one of the workshops that lasts an hour and a half with Q&A, and then someone else will jump into a different workshop. So maybe like a series of 3 workshops or so within a 4-hour time period, but like saving that spot for your relationship to enhance it, grow it, you know, make it better on a Saturday, like feels kind of cool, you know, do it in the comfort of your own home, you know, sip a glass of wine or sit in the hot tub and, you know, participate in the retreat. Like, I think you could make it just as cool as like camping in a tent out in the middle of nowhere.
Yeah, no, that's just really interesting. It's amazing like what people have been able to replicate and make digital copies of.
Totally. I think we're getting really good at it. I think we've had a lot of practice for the last year and a half.
Yeah, the last year. Oh my God. About a year. Yeah, a year and a month. Crazy. So the next thing I wanted to talk about was the last year. And I know, you know, I mean, for the last probably 10, 15 years, I think we've had a mental health crisis in America. And I think that probably that was accelerated even more so with the lockdown and people losing their jobs and being locked up in their house. So what is your kind of like take on that? How have things changed for you? I know you said you had like an explosion of requests. Yeah.
Yeah, people aren't doing well. And I don't think that's any shock to anyone across the world, right? I especially think it's an extra added layer because we're not only helping people go through really tumultuous times, but we're also going through the exact same thing at the exact same time as our clients. And honestly, it's the first time I've ever experienced that. I think it's the same for a lot of mental health professionals, that this is the first time we're like parallel playing with our clients going through the same traumatic stuff at the exact same time.
Yeah.
So there's that, but I think we're finally like hitting a place, and I could be totally wrong here. I was just hosting a workshop for workplace violence and talking about the recent shooting in Colorado in Boulder, and, you know, kind of working through that and processing that and helping providers help other people work through and process that. And we were talking a lot about like an ostrich, you know, like they can stick their head in the sand and we can do that over and over and over and over and over again. But at some point, like things just combust and explode. And I'd really like to think we would get to a place where we're like, okay, people are not doing well, and like we need to make mental health resources a little bit more accessible or normalized, or decrease that stigma even more, or like really take away that layer that's preventing people from getting help. Or else I think it's the couple's conclusion too, you know, instead of like getting a divorce, is there a way that we can prevent the explosion from continuing to resurface by putting extra skills, tools, resources, coping skills in that spot? So I think we've gone so far and so long with our head in the sand that we just can't like really sustain ourselves at this pace anymore.
Yeah. People just are compressed. Sorry, go ahead.
No, I was just thinking about like recognition too. Being able to recognize when someone has like passed the point of not doing well into like a clinically critical category. I think, like I said in the beginning, a lot of people think of mental health as, you know, okay, you're just weird, or you're just different, or you're just bad, or you're just a less than human being. But if we normalize the fact that everyone has the same issues, it's just whether or not the spot is so dark that they can't see any light, or the spot's just dark enough to where like there's a problem, but it's not so blinding, that there's still some light in there. So like being able to access people where they're at, like really taking a hold of the folks that have hit the dark spot with no light, and helping those folks first. Obviously, the people that are in dark spots that still see light need help too, but not as badly as the ones that don't see anything positive going on in the world or their life or with other people.
Yeah. Yeah, I think honestly, one of like the most important things would be to teach people, other people, how to recognize those people in their lives. You know what I mean? So like being able to, for somebody like me who might not be able to see that in someone, I don't know, being able to look for like the telltale signs that say your friend needs help, or, you know, whatever. Because if we can, I think that's the problem. It's like very difficult for you to recognize it yourself, or like bring it to your own attention. So that's where like friends and family come in, you know, and play a big role.
Totally. And honestly, there is a small group. Well, you're never going to hear from them, and they're just going to react according to whatever comes to mind in that really dark spot with no light. You're not going to get any prior indication. You're not going to get any warning. It's just a very small stat in that category that says like they offered us no insight into things were going terribly south for them. But there's this much larger category that says they keep telling us, you know, maybe not directly, maybe not saying like, hey, I'm not doing well, but there's other indications where we can say like, that's different for you. That's abnormal for you. Can you tell me more about that, or tell me like what I can do to kind of get you to the right spot, to get you some more resources, or to get you some assistance. There's signs typically.
I think people just are, like you said, it's just like compress those feelings, and then all of a sudden one big explosion.
You explode, and I think we're getting there. We're getting there if we don't start to take our head out of the sand.
Well, we've already been seeing it, you know, totally. So much. So we're thankful for people like you. What was like the other thing I wanted to say was, in terms of your actual, not traffic, but demand, did it double? Did it triple? Like, I know when I was on your Instagram, I just quickly clicked the link to, I don't know, I think it was to schedule a consultation, and it said it was full. I was just curious to click the link, but I was like, oh wow, she must be busy. But anyway, so how much busier did you get? And like, have you not been able to take on more people, or?
You know, I think it's ebbed and flowed, which that's a component of mental health anyway. I think there's certain seasons where people like really need help, and there's other seasons where people don't need as much help. But I do think my caseload has maintained a steady, like, wow, like you're really busy. I think it's maintained that. It's waxed and waned a little bit, but it's maintained kind of that status. I'm not actually full right now. I think there was a glitch on my LinkedIn, on my, for the consultation form. I think my social marketer is taking a look at that and hopefully helping me fix it. It's surprising sometimes that I'm not like super technologically advanced, considering that's all I do. But I'm not.
Everybody listening, that was a mistake. Okay.
Got spots. Yeah, I still have a couple spots. It's fairly limited, but there's certain niches that I tend to focus on. So I'm always like kind of, getting people in my office to talk about what's going on with them, to see like if we're going to be the best fit. Not everyone is the best fit, right? I think the most important thing in a therapeutic relationship, independent from how you do it, whatever modality, is the relationship that you have with your therapist. So you're going to click or you're not. And I think it's important that we find the best fit for us, so we have the highest probability of success. So always happy to get people in my office and give them a trial run of like what it would be like to work with me, or, you know, what we hope to accomplish,
Sure.
you know, setting up their behaviors in alignment with their values, that type of thing. So
Absolutely.
my apologies.
Not at all. And if somebody wants to reach out to you, they want to get in contact with you, does your private practice have a website that we can link? Okay.
Definitely. So it's betterlivesbuildingtribes.com.
Okay, perfect. I'll put a link into that. And then anything else you want me to link, let me know.
Dr. Meaghan is great. Like, I'm a huge fan of Instagram. So
Dr. Meaghan. Okay.
Yeah. All of those links are on my website as well. I have Twitter, Pinterest, Instagram, and Facebook on there. So if you go to my website, you can see those links as well.
Awesome. I'll make sure to include that. And Meaghan is spelled Meaghan, right?
All the letters.
All the letters. Okay. Very, very cool. Doctor, thank you. I appreciate it. And one last question I was going to say is, anybody was listening and they were thinking about getting into either becoming a therapist or a psychologist, would you have any recommendations for them?
Yes. I would recommend getting your social worker license, because it's just so wide range. You could like literally do anything you wanted: government, private practice, community mental health, any sort of contracting with insurance companies. You could like literally do anything with a social worker license. I went for an LPC. And while that's great and I'm licensed and it gets me in most doors, there's some doors that I can't get in because they prefer the social worker license. So I recommend that to all of my peeps that are looking to come into the field. I also recommend doing an online counseling program that has like a combo of like a little bit face-to-face stuff for internship requirements, practicum requirements, but primarily having that academic piece online, so you can move around and be versatile and kind of go with the times. You know, things are changing so much with the telehealth world. That's just helped me out tremendously as we've traveled the world, being able to finish up my education as we were kind of like all over the place rather than having to stay in one spot. So
Awesome.
More fluidity, the better.
Absolutely. Okay. I think that's great advice, and we'll wrap it up there. Meaghan, thank you so much, and we'll talk soon.
Awesome. Thanks so much.
Yep. You got it.
See ya.